Hello and welcome to another edition of For the Record. I'm Sean Murphy. My guest today is Tamara Ruggiero. She is VP of Communications and Marketing for the American Kidney Fund, and it's her first time on the show. Flew a long way to get here, but thank you for being on the show, first of all.
Thank you, Sean.
So tell us about the American Kidney Fund. What is it?
The American Kidney Fund has been around since 1971. We are a national nonprofit organization. We help dialysis patients pay for their treatment-related expenses, and then we also reach out to the general public to help them prevent kidney disease.
And kidney disease in general, do you think enough as far as the word getting out about it exists? Or, I mean, I know you're coming on a show like this to talk about it, promote it, and talk about your organization too, but is it one of those things, is it a disease in general that kind of like falls by the wayside as far as comparing it to lots of other things that are going on?
I think that's definitely the case. We're really trying hard to make people more aware of kidney disease because it's prevalent. It's one of the top 10 killers of Americans. It's estimated that 31 million Americans have some stage of kidney disease, but most people don't know it. It's one of those conditions that, you're right, is just not that well known.
How's it diagnosed as far as people kind of discovering that they may have an issue for the first time? And I want to get into the infant stuff too, but just people in general.
For many people, they don't realize they have kidney disease until they're almost in kidney failure.
Really?
It's a silent killer. It doesn't present symptoms until it's really far along. So you can have kidney disease for years. It's a progressive condition.
And not have any symptoms at all?
Right.
Wow. Yeah.
Silent damage to your kidneys. It's most often caused by diabetes and high blood pressure. Those two conditions account for 2/3 of all kidney disease cases. But people can have it for years and years and then start to develop symptoms when they have almost no kidney function left. That's when they go to the doctor because they're not feeling well. They have these various symptoms. The doctor tests them and they discover that they have kidney disease.
You know, you mentioned diabetes, and that is such a diabolical disease because it causes such a domino effect with everything else in your body, including kidneys. But and you can have you'll get to a point where you start talking about it's easier to describe what isn't wrong with a person than what is when diabetes really takes hold of the body. Don't you think?
It is. It's really a terrible condition to have especially if you're having trouble managing it. I think that's the key. If you can work with your doctor to manage your diabetes, get a treatment plan, follow it, you'll be in much better shape, helping to prevent all of the complications of diabetes, not just kidney disease, but the many other complications it can cause.
If you can control diabetes, you're not only controlling that, but everything else that happens because of diabetes, right?
Exactly, exactly. I mean, it can lead to blindness, amputations, a whole host
neuropathy,
of problems, exactly.
Heart issues, and as it turns out, kidney issues and kidney disease. Would you say, I don't know how long you've been doing this, but would you say that there's medical advancement in the field of treating kidney disease? Do you see progress being made? I know that you're not a doctor, right? But you're plugged in enough where you can see some progress or lack of progress being made?
I think where the progress is being made is really, there are medications coming out all the time that help people who are on dialysis better manage the experience of being on dialysis and not having functioning kidneys. So, for example, medications to treat anemia, which is a common side effect of having kidney failure. That's really important to dialysis patients. There is research ongoing to find cures for kidney disease. I think that's a long way down the road, though. So for now, what we really have to focus on is prevention, because many cases of kidney disease are entirely preventable.
Just like diabetes itself, I mean, especially is it the type 2 that's preventable, or type 1 is what you're born with, but type 2 is what you kind of develop over the course of time just through, I guess, bad life habits, right?
I think a number of factors can lead to type 2 diabetes.
Right. So for kidneys, as far as preventative things, what can be done ahead of time as early in life as possible?
It really goes back to just living a healthy lifestyle. All the advice you hear for staying healthy is the same thing that's going to protect your kidneys. So, keep your weight in check, eat a healthy diet, get exercise. If you have diabetes, manage your diabetes. If you have high blood pressure, manage your hypertension. avoid smoking, stop smoking if you currently smoke. All those things are going to help to protect your kidney health. And then really, if you're at risk for kidney disease because you have either diabetes or high blood pressure, or you have a family history of kidney disease.
So it's hereditary then too. Yeah.
If you have those risk factors, then you should be talking to your doctor about getting tested just to see where your kidney function is and keeping it monitored.
If a person goes and gets a typical physical, are there things in that process that they can kind of have tested as far as kidneys go to just make sure there's normal function going on?
Yes, and it's really simple. It can be done as part of your just normal physical blood work. It's a blood test and a urine test that can tell, give a snapshot of how well your kidneys are working.
If you were to look at a graph right now, where's the trend going as far as, I would imagine that if you're able to detect kidney issues earlier, then maybe the trend is actually going up as far as people detected with kidney disease or some kind of kidney problem. But at the same time, I would assume early detection means more can be done for it.
Definitely, the earlier you can detect kidney disease, the better off you're going to be. Because if you catch it and it's still not very far advanced, you can slow the progression of it or even stop the progression of it. It doesn't have to advance all the way to kidney failure or to the other serious consequences of kidney disease. Kidney disease can cause a heart attack, it can cause stroke, it can cause death. So the key is to catch it when it's early so it doesn't progress.
What are some symptoms that people, like maybe early on, would start to feel? I mean, it's not just a matter of just suddenly not feeling well, which could be a case, but are there very specific symptoms?
There are, but they don't occur early, they occur late.
Late, so it's kind of like too late.
Right,
almost.
when your kidneys are, kidney disease is the progressive loss of kidney function over time. So when you get into like stage 4 kidney disease, which is where you're very close to kidney failure, you can have things like swollen ankles, facial swelling, especially at night, in the morning when you wake up. You can have bloody or dark colored urine. You can have excessive fatigue. Your skin might be very itchy. Those are some of the typical symptoms. But
is that in the later stages?
Yes,
or is that,
in the later stages. So like I said, you can have kidney disease for years and not know it until you might start to experience these symptoms. Then you know something's wrong.
Yeah.
But those symptoms can be symptoms of many other conditions, so you have to go to the doctor and find out what's going on.
Describe to me sort of a layman's definition of what kidney dialysis is, because people hear it and might not understand it in a medical sense.
Dialysis is a life-sustaining treatment. So once your kidneys have failed, you have two options for survival. You can either begin dialysis, or if you're lucky, you can have a transplant. But the transplant waiting list is long, and so most people generally will have to do dialysis to survive. So dialysis is a treatment that cleans your blood.
Because the kidney itself is a filter, right?
Right. So dialysis replaces that filtering function of the kidneys. Now, I think what people don't understand is the kidneys have many other jobs other than filtering and cleaning your blood.
But that's what they know the most. Yeah.
Right.
What are some other things that kidneys do that are help the body, so to speak?
They help you to have strong bones. They help to produce red blood cells. They filter toxins out of your blood. So your kidneys are really essential to your overall health. So dialysis performs the filtering function of the kidneys. So if you're on dialysis, that's being taken care of. Most people go to a dialysis center 3 times a week and have a treatment for about 4 hours at a time. They're hooked up to a machine. Their blood is all filtered, the wastes are removed, the extra fluids are taken off, and then a couple days later they come back and repeat the process.
When you're done with a kidney dialysis treatment, because it's taking out all the toxins and filtering it, does a person feel very much better after a session, so to speak?
It kind of depends. Sometimes people actually feel worse after the session because it's hard on your body.
Yeah.
And especially, if you're on dialysis, one of the things you have to do is really limit the amount of fluids you take in, because when you go for your treatment, the treatment is taking those extra fluids out of your body. So if you've taken on too many fluids since your last treatment, the process itself is a lot more draining. People can experience cramping, and it's really hard.
And
on
very
you.
Just fatigue, I would
Yes.
imagine, right, from
Yes.
it. Yeah, obviously, it probably goes without saying that you should limit your alcohol consumption.
Mm-hmm.
You know, your liver really takes the brunt of it, but kidneys also are affected by that too if you're overdoing it, right?
Oh, sure. Alcohol can affect your entire system,
Yeah.
including your kidneys. Absolutely.
So not a good thing. Ease up on that if you can. Yeah, and you also hear maybe at times people donating a kidney. So
Mm-hmm.
obviously a person can survive with one kidney, but then all of a sudden its workload is doubled, right?
Well, you can survive with one kidney
Right.
fine. So I guess you could say its workload is doubled, but I think that's one of the misconceptions. People are afraid to give a kidney because they're not sure what's going to happen.
Right. They'll suddenly
You'll be
their
fine.
life will be different. Yeah.
Yeah, but really not. You'll be fine if you donate a kidney. It's quite safe, and we're trying to get the word out that if more people could donate as living donors to people who are in need, it would really help those who need a kidney.
So let's talk about that a little bit because obviously you had mentioned before that people have no choice but to opt for kidney dialysis because a transplant could be out of the question because the waiting list is so long. Now there are organ donors for after they pass away where you can harvest organs such as kidneys, but not a lot of the living donor that exists. Talk about that a little bit.
Well, actually, the number of living donors is increasing,
That's a
which
good
is
thing, yeah.
wonderful. So I think people are becoming more aware of living donation. They're realizing that it's something that they can do and be comfortable with. So the number of living donors is increasing, which is great. We still need people to, if you want to be a donor after you're deceased, you need to not only fill out the form, but you need to let your loved ones know of your wishes so that they can be carried out. As far as living donors go, like I said, the trend is upward, which is good. There's still a big deficit in the number of people who are waiting for kidneys.
Yeah.
Right now,
How long are we talking?
It can be 5 years.
Wow. Okay.
But it really depends. I mean, we have one patient who is one of our AKF, she's in our AKF advocacy network. She's a wonderful woman, and she's been waiting for a kidney for 13 years because she has a rare blood type. So she's getting a transplant this summer. We're very excited for her. So there are a lot of different factors that go into it.
You may, every once in a while, you'll hear, if it's a big news story, a big media story where, some little girl gets a transplant or something, or maybe you'll hear about somebody sort of somehow getting some special treatment where they can somehow jump the list and, get toward the top or something like that. How does that even work,
I don't think that really happens.
No, it's like more media.
You hear people alleging that has happened,
Yeah.
but that doesn't. The system that's in place is pretty regimented and pretty strict as to you're on this list. These are the requirements you must fulfill, and they look at different factors to decide where you fall on the waiting list. So if you're a celebrity, something you can't really go
You can't
to the
buy
top
your way
of
to
the
the
list.
top.
No.
No. It's not the same as, it's a lot easier to go in and donate blood, because there's always a blood drive going on, and you just kind of pop out your arm and then you're good to go. Donating a kidney or any really kind of a major organ that you can and still be okay after, that's a much more complicated,
Right.
And also like more psychologically, you really have to think about it. Like you said, misconceptions of what you can get away with giving up and still living a normal life,
Exactly. And, I think one of the interesting things about kidney donation is if you donate your kidney and then later in life, for some reason, you need to transplant yourself, you are moved to the top of the list.
Oh, okay. So that's one way to get to the top of the
Yeah.
list. Well, it's because you donated one in the first place, so I can understand
exactly.
that. Makes sense.
Exactly. But no, you do need to be mentally prepared to do that, and plenty of people are not comfortable with it, and that's totally understandable. But we're hoping that as word gets out, more people will be comfortable and they will, consider it as an option.
Kidney transplant, is it a fairly simple procedure these days as far as surgery where it's fairly safe for the most part?
It is safe.
Yeah.
I mean, it's a major surgery. Any
Right.
surgery has risks,
Right.
but it's also it's the most common organ transplant that occurs.
I guess it's the easiest, right? So
I don't know. I'm not a doctor.
Right.
So.
Yeah. We can't imagine really how that
Right,
could
I
be
can't
easy
imagine.
at all.
No, I think it's a miracle, but it's really amazing what it can do for people.
What kind of other advocacy is going on as far as the American Kidney Fund is concerned? Talk about other ways that you kind of get out there and get the word out and what you're looking to accomplish.
Well, we have a mission, like I was saying earlier. Our main mission for years was to provide financial assistance to dialysis patients. And that still is the case. That's really the core of our mission. Last year we helped 1 out of every 5 dialysis patients in the country with their treatment-related expenses. Here in Connecticut and Rhode Island, we helped about 3,000 patients pay for their health insurance and pay for other out-of-pocket costs that they otherwise wouldn't be able to afford. So that's
and for those in Massachusetts watching too, same situation.
Yes, exactly. Thousands of people also in Massachusetts as well. So we help people really in all 50 states.
The current state of health insurance in this country, does that make your job more daunting just because of them, the number of people that might not even have any health insurance at all and the expense of it in general, as far as you're needing to help people out financially, as far as dialysis goes?
I think healthcare costs are a huge issue facing this nation. Where we try to help is, our biggest financial assistance program is called our Health Insurance Premium Program. So if you need help paying your health insurance premiums, we have a fund that can assist patients with that. And the patients we help are those who have no other source of assistance. So they've gone everywhere else to try to get help and they can't afford it, and through their social worker at the dialysis center, they come to us and apply. So that program assists people who have insurance. The interesting thing about kidney failure is that it's the one condition that Medicare covers regardless of your age. So most people who are on dialysis are going to be covered by Medicare.
Oh, that's good. Yeah.
But if they have lost their job because they can't work anymore, or they're just low income for other reasons, it can be challenging even to pay the Medicare premiums, and we help with that.
Yeah. We're going to take a break and come back. Is there a website people can go and learn more as far as the American Kidney Fund is concerned?
Yes, it's kidneyfund.org.
All right, pretty simple. Put the graphic up on the screen too. Tamara
Ruggiero.
I knew I wasn't going to get it right. I can tell you this, though, VP of Communications and Marketing, and she does a great job. We'll take a short break and come back, so stay with us. I'm Sean Murphy. This is For the Record. Welcome back to For the Record. I'm Sean Murphy. My guest is Tamara Ruggiero, VP of Communications and Marketing for the American Kidney Fund. It's her first time on the show, learning a lot today. And so we'll just kind of keep going. One of the things, when you're talking about a nonprofit, is fundraising. And one of the things you do, you have a big online fundraising, or people have the ability to do some fundraising, and you guys online. So talk about that a little bit.
Yes, we help patients in every state of the country, but we don't have affiliates all over the place.
Right.
We only have a few regional offices. So we do have online fundraising available. If people have an interest in helping out their friends and neighbors who have kidney failure, they can go to our website, kidneyfund.org. We have a number of ways that people can give. One mechanism that's becoming more popular is our virtual walk. So
it's not a real walk?
It's not a real walk. It's a virtual walk. You can do it anywhere in your community. You can decide, I'm going to set this goal for myself, and I'm going to ask my friends and loved ones to pledge to me, and then give the donations to the American Kidney Fund. It's a great way to help out and also get in shape.
Yeah, absolutely. You're helping yourself out and getting the word out and raising some money at the same time. When it comes to fundraising, it's always a difficult thing, especially when you're talking about the economy that we've been in over the past few years. And I don't know if you would consider us at this point, coming out of the recession, but have you noticed an effect on your organization as far as people's either ability or willingness to give as far as your organization goes?
I think every charity has felt the effect of the economy, and I think the economy is showing signs of improvement, which is great. So we're positive about that.
Would you say that from your perspective, can you see an improvement as far as people's ability or willingness to give money? Do you see that?
Yeah, things are definitely on the upswing, and I think that people are becoming a lot more discerning about who they give to. So they're looking for a charity that's efficient in its spending and is also having an impact. The American Kidney Fund, 97 cents of every dollar we spend goes to our programs and services. We have very little overhead compared to the revenue that we're bringing in and then what we're dispersing. So people can feel confident, first of all, that we're using their contributions wisely, they're really helping, and also that we are making an impact. We are changing people's lives through our grants that we give. For example, we have one patient who came to us and said, you changed my whole life. I developed kidney failure. I didn't realize I was at risk. And then it had a domino effect on his finances, and he ended up becoming homeless and living at a truck stop in his SUV for several months while going to his dialysis treatments 3 times a week. And he, through his social worker, applied to us for assistance. We helped him, and our help with his healthcare costs helped him to get back on his feet. And now he's, has a home that he lives in, and he volunteers to help the homeless while he's undergoing dialysis treatments. So stories like that are, the real impact of your gift.
So he's able to give back in some way while he's receiving help and treatment, which is a great thing in itself. You mentioned some of your programs, and one of the things was the screening program. Talk about that a little bit.
We do. Last year we performed free kidney screenings in 22 cities across the country. And we invite the public to come out and find out how well their kidneys are doing. And
is that a simple process for people when they're coming out to do that? Is it a quick process?
It is. It's pretty quick. Generally what we do is, people come to the screening, and the first thing we do is give them a risk assessment questionnaire to find out if they are at risk. If they have certain risk factors, if they tell us that they have diabetes or they have high blood pressure, or if we take their blood pressure at the event and it's high, then they'll move on to the full kidney screening.
One of the things I wanted to touch on was, diagnosing younger kids, children, as far as kidney issues. And one of the things, kind of cool things you have is sort of an art contest for kids. I want you to talk about that a little bit.
Yes, kidney disease in children is pretty rare, but it does happen, and when it affects a family, it can be devastating. It's really difficult to deal with. Children in particular who have to be on dialysis, unless they're in a major metropolitan area, they're usually at a dialysis center with just adults.
Yeah.
They don't have a lot of fellow kids who are in treatment with them, so it can be really isolating for the kids and
scary,
and for the families. Scary. And we have a national art contest for children with kidney disease. It's in its 18th year now, and what we do is, we solicit kids across the country who have kidney disease, either kids who are on dialysis or who have kidney disease but not on dialysis, or who've had a transplant. And they send in their artwork, and the 13 winning entries are in our wall calendar that we publish each year. And then we run a contest on our Facebook page and on our website to choose the winning artist, and that piece of art is on the cover of the calendar, and that child and their family gets to come to our gala in Washington, D.C. in the fall and be honored and recognized there.
Wow,
so
they get to come to D.C. too.
It's exciting. It's exciting for them, and it's I think a good way to support kids and their families.
Absolutely. We are just about out of time. You know what? You mentioned something, and so now I know the American Kidney Fund is plugged into social media because you mentioned your Facebook page too, right?
We do. We have a really active Facebook presence. So if you search for us on Facebook, you'll find we have nearly 70,000 followers now, and people are on there every day engaging in conversations with us about things of importance to kidney patients. So anybody who's been affected by kidney disease should check it out.
And I'm sure people can click on a link if they go to your website, and they can go to your Facebook page too, correct? What's the website one more time?
Kidneyfund.org.
Tamara Ruggiero, the VP of Communications and Marketing for the American Kidney Fund. Pleasure having you on the show today, and we learned a lot, so I thank you.
Thank you so much, Sean.
And we thank you for joining us for another edition of For the Record. You can see this show and many others on our YouTube site. We'll see you next time. I'm Sean Murphy. Take care.